My name is Joe Poloni. I'm a PT on Ignite Physical Therapy. We're in Chandler, Arizona. I graduated from PT school in 2009, so I've been doing it for a while. I went to AT University, which is in Mesa, Arizona. Did my undergraduate, grew up in New York, so kind of relocated across the country. And we started our practice in 2014. So one of my favorite things to treat is the cervical spine and cervicogenic headaches. I'm kind of passionate about it. I've always struggled with strengthening for the cervical spine. There's not a lot of research out there on it. There's not a really lot of tools that you can use without like looking goofy with the TheraBand around your neck and around your head, doing crazy stuff like that. And so I've always kind of struggled with the strengthening portion. I've always been really good with the manual portion, but incorporating strength to get the lasting results or to get them a few more months before they get a reoccurrence has always been a challenge. And I think the next level is like super simple, easy setup. I mean, the patients can really do it on their own, and it takes not a whole lot of time. So I feel like it's really kind of changed the game in that perspective of incorporating the cervical strengthening into the plan of care where it's simple, straightforward, easy to do, easy to use, easy to progress. It's a really cool tool that you developed. It's cool because you're reinforcing what you're trying to do during treatment. So if you gain, say if you gain 15 degrees cervical rotation during a treatment in the first 15, 20 minutes of treatment, if you could take them and in 10 minutes, have them use that range of motion, I feel like it just creates that neuromuscular control that is usually the missing link. And they're generally pain-free with it. So we're not pushing into any painful range, especially after the manual portion of treatment. So there's no painful range. The resistance, a lot of times they feel like they didn't realize they're as weak as they are in the ranges that they get into. So I think that's a really cool thing about it. It's kind of patient education at the same time. I'm hoping to get another one because I feel like we're using it pretty often where I see a lot of necks throughout the day. So that's kind of somewhat of my specialty. I'd say I use it on probably about 80 to 85% of my cervical patients at this point. And a lot of times when I'm not using it, it's if they're fresh and really irritable, or if they're moving on where they're in like the really highly functional phase of their protocol where we're doing more like overhead lifting, things like that, where they already have that strength down. But every one of my cervical patients gets it at some point during the plan of care. I have recommended it to my colleagues in the industry, the ones that I know close enough to shoot them a text and let them know about like new equipment that I get. I texted all those guys and let them know that it is a cool device to have. It's definitely useful. It's kind of solving that missing link in the cervical rehab process. Well, I feel like with the headaches that I get, like the cervicogenic headaches, a lot of patients think that they have migraine headaches, and then they come in and we can kind of properly diagnose them with a cervicogenic headache. Once we treat them, we can create some change there. A lot of those people that be super scared to move, to do anything to flare up their headache or when they have the headache, they do pretty well with something like just a simple chin tuck on that or a resisted chin tuck. You can kind of just calm down those muscles and the soft tissue in the upper cervical spine, as opposed to giving them something to do in sitting or standing where it's just kind of where they're highly irritable. So something that it's a calming treatment. You're just laying supine. It's pretty easy, gentle, and then you can slowly progress into it. So I feel like it helps with their like the mental portion, the psychological portion of those headache patients where they feel like it's always there, it's always about to be there. So they're kind of fearful of that pain where you can kind of break that fear cycle. There have been a few aha moments for the patients where it kind of breaks that cycle of fear where they can kind of move on with their headaches and accept that they can move. I think the product is worth its weight in gold as far as what it does and delivers. It seems simple, but it's a really good tool to have. I've used it probably hundreds of times since I've had it.